Too often, when conversations about safety of any kind are had, workers in the public safety are left out. However, it's difficult to argue that a state or local government can keep their residents safe when they've not focused adequately on keeping public sector workers safe. We'll talk with a safety professional applying his craft in the public sector for this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. Safety at work is more than freedom from physical injury. To be safe, you have to feel safe. Join us each week as we discuss psychologically healthy and safe work in the USA. Welcome to this week's Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase the awareness of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, and advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. While the public sector represents about 14.5% of the workforce, that's about 20 million people, it is overrepresented when we talk about the percentage of injuries. Because if you were to look at a pie chart and look at the per worker injury for the private sector and the public sector, you'll often find that public sector physical injury rates are always much, much higher. Anywhere from 75 to as high as 90%, depending on the industry and the occupation. And remember, the public sector does everything. You name it, the public sector does it. They build buildings. They dig ditches. They transport things. They transport people. They also arrest people and put fires out and, and clean sewers and things that the private sector probably doesn't want to do or doesn't do as efficiently because there's not profit in it. Unfortunately, though, the conversations around safety, because of the way the OSH Act was written, it excludes most public sector workers. So many folks who work in the public sector, they get virtually no real protection from a safety perspective because the local officials will tell you, well, we're not covered by OSHA. They're not going to inspect us. Nothing's really going to happen. So we do what we do and we'll just find another person. I'm here to have a conversation today with a public sector safety professional who's kind of broke the mold. He works in a jurisdiction who, for whatever reason, has decided that the safety of their employees is important. It's in a state that doesn't have a real rich history of worker safety. But again, they're breaking the mold and taking the safety of employees as important. So my guest today is Nathan Benson. He is with, and I'll let him tell you more about himself before I go into introducing him, because that's why I have this opening question to you, Nathan. The question is, who is Nathan Benson?
It's an onion with many layers there. So first of all, I'll say thank you for having me. I know we've known each other for about 7 years now since we first met. And that first conversation was around public sector safety. So I appreciate that. Who's Nathan Benson? So, I'm a father, I'm a veteran, community advocate. And I developed a passion for safety. I didn't know what safety was when I started. So I grew up in a small town in Tennessee, running a manual lathe, just trying to make ends meet like everybody else. And here I am, serving a community of 280,000 people with 1,900 employees, talking with you today.
Absolutely. Absolutely. So what does psychological health and safety mean to you?
I think, especially in the U.S., that's such a new field. As I kind of mentioned, didn't have much experience to that until, you started talking about it and different people in the industry started bringing that up. So psychological and health and safety, it's really not too different from physical safety when we think about it. We have a saying in our office, our bad day is somebody's worst day. And that goes to psychological too. You don't know what phone call people got the night before with their mom has an illness or their nephew was in an accident. And people bring that to work. And all of those distractions, those psychological distractions, turn into physical distractions, which can impair both their safety and the safety of their coworkers.
Yeah, absolutely. Yeah, I spent most of my adult life working in the public sector,
Mhm.
and I continue to have this real concern and interest that people don't seem to talk about safety in the public sector all that often. I mean, you're in a jurisdiction that has, as I said, decided to have a safety program, a full functioning safety program. And that's unique, particularly in the state that it's not a state planned state. There's a bunch of
Mhm.
reasons why folks would say, well, why are y'all doing that? But for whatever reason, they've decided to do it. And that's a good thing. So let's turn the clock back for a second. So what really, was there a particular incident or situation or something that got you interested in health and safety in general?
So there's a couple different scenarios that kind of made this all come together for me. As I mentioned, I'm a veteran. So when I was serving in Iraq, one of the officers assigned to us was our safety officer. I was in the regimental protection division platoon. And so I had that experience from a safety officer on the military side. And I was kind of like, I was young and like, that's cool. He's got a cool job. But when I came back stateside and was working for a small company, got involved with those things that nobody else wanted to do, those JHAs, those safety committees, and kind of developed that passion. And then, but like I said, one day we had an incident, and it completely changed. We were used to those small things that you're used to, acid burns, or I say small, but those minor injuries. We had a well-qualified engineer, didn't want to take the time to get somebody, was using a ladder and he fell and, ended his career. Very disabling injuries just from 6 feet. And so that kind of is like, whoa, we need to be doing more. And so our company stepped up. I stepped into that role, grew, started getting education. And I still talk about that experience, regularly, because go back to what I said, right? Our bad day is somebody's worst day. And, it's more than just making sure people get home at the end of the day. It's truly a passion.
Sure. And as you mentioned a little earlier, our paths crossed. Going to get that out here. So our paths crossed while we were both a part of the government and public sector division of the National Safety Council. And again, that whole thing started because, again, a handful of us at the time noticed, some of the injury rates in the public sector, and there really wasn't a conversation even at the NSC about government and public sector workers. So, how did you, where you're working now? How did you end up there? I mean, how did you go from the private sector, where again safety tends to be, and again, I'll be honest about at least my perspective about the private sector. They don't all do it because they want to, but a lot of them do it because they have to. I mean, it's not really a choice. So how did you end up in a public sector situation doing the very same thing?
So for me, it was kind of like the stars aligned. So I said, living in a small town in Tennessee, I wanted to get to the beach. I wanted to come to Savannah, right? Everybody that's been to Savannah wants to come back. So started kind of looking around, and Chatham County had this position open to start a safety department. And it was a perfect match. I mean, I stopped what I was doing and said, I've got to apply. At the time, the county was experiencing you talk about the reasons why, right? Workers' compensation. So when you're dealing with indemnity costs, medical costs, that's taxpayer money. And so if you're going to be a steward of taxpayer money for buying fire trucks or, buying trash trucks, you've got to be the same on the workers' comp side of things. So that's kind of how it all started. We were a really small department. Now we've grown. We've got 6 people, and it's just been a perfect experience with lots of support from management and our board. You can't say enough about your elected leaders when they buy in and they do proclamations or resolutions and stuff honoring, National Safety Month or Lifesaver Awards we just had. So it started off as something real small as, our workers' comp is very high, to all these other programs and things we're doing, which in turn lower that workers' comp rate.
Right, right. Yeah. Well, if you were to look at the budget of most local governments, I'd venture to say that more than half, and in some cases as much as 80% of the budget of a local government, so that's a city, a town, a village, or whatever it is, that 50 to 80% of their budget is going to be people. And it amazes me how little attention is paid sometimes to those people. And as you said, there's a big in-depth kind of plan on how to replace trash trucks and police cars and lawnmowers and all these kinds of things. And these really intricate policies and procedures on how you maintain them. And the people sometimes are an afterthought. And again, what I'd heard, and I've heard it more than once, is that, we're not covered by OSHA, so we don't really have to do anything. And I also find it interesting that particularly those who are into efficient government, effective government, and less costly government don't pay attention to all the money that they're literally bleeding because they have injured workers, sick workers, people breaking their arms and legs and ruining their backs and being off on disability, and then the workers' comp piece. It's amazing that more folks just haven't caught on that good government is generally taking care of the human beings that are providing the good government, and actually be a lot better for you.
Yeah, and kind of you mentioned that there's so many simple things you can do as a government. We were having 3 to 4 rear-end collisions a month, back 7 years ago. And we're now down to 2 or 3 a year.
Really?
Just by simple things that, increase visibility. And we actually got it. The fire departments do it. They put the big, yellow chevrons on the back, and you see a fire truck when you're approaching it. You take that same approach and you put it on these kind of bland white government cars, people can see them. So just a couple extra seconds of depth perception. And that's the value of having a safety department that's proactive and engaged, is you find those easy solutions for the taxpayer that ultimately saves them money on the back end.
Absolutely. So particularly during the pandemic, we saw a lot of workers that, again, generally folks had kind of forgotten about, all of a sudden became essential workers. And a lot of those folks worked with you. Because they're government folks. As much as many of these private sector operations could just shut down and send their people home and not worry about it, the government kept functioning as much as people, whatever that means to people, but it didn't close because it never does. So, and post-pandemic, we've had more conversation about how these workers were feeling at work. So share a little bit about, what was the experience of, the public sector folks you're around, both during and after, the pandemic?
Yeah. So, kind of as you mentioned, about 50% of our workforce of 1,900 employees is first responders. We have a correctional facility, sheriff's department, police department, 911. You can't send 911 dispatchers to their house. I don't think the public would like that very much. The same thing with police, right? You can't police the roads from the house or pick up trash. And so what you saw a lot of stress, number one, because people didn't know, especially early on in the pandemic. So is it safe to go to work? And, as a safety officer, it was challenging because I'm dealing with something new that I haven't dealt with. And so you're trying to put in, protective measures and all this stuff. And people are still going, am I safe? I have a 80-year-old mom and dad that live with me. Am I going to bring something home? But at the same time, if trash is building up on the side of the road, that's a safety hazard, right? You start getting pests and all these other things. And what you saw was a divide. So you had some workers that could, your finance staff, HR staff, that could work from home. And then you had those other set of workers that had to come in, to the office, if you will. So managing those, because it's two different expectations from that population. And then trying to bring everybody back. People feel safe at their house, generally. And then you're bringing them back to an environment that originally you sent them home because, it wasn't safe to be there. And so now you've got to break that kind of that mental block of saying, yes, we need you back here because we need car titles processed and business license processed. So it's been a unique challenge to kind of navigate through. And then if you throw in, the ADA, so when you start dealing with people with accommodations, that starts playing in. So we're fortunate enough, our ADA coordinator actually resides in the safety office. So when we start looking at these, especially these kind of psychological accommodations, they're right here in the same office that's working on physical accommodations, physical safety, because it's kind of one of those things. The more accessible we are, the safer you are, right? You don't have slip, trips, and falls, and you kind of remove those barriers for accessibility to improve safety, whether it's physical or psychological.
That again that's a fairly unique setup. It sounds like to me to have the person dealing with ADA under the safety umbrella. It sounds like a great idea. It sounds like it's working well.
It's working very well, and that's I think it's one of the things we kind of do great here is our team's not traditional. So when we look at like our ADA coordinator, he's also our facility safety guy. So when he's going in, he's doing the fire alarms, and like right now we're working on elevator projects. So it's not only, do all the calls, buttons work and is all that, but it's also we're including, is the braille up to date? If somebody's blind and the elevator stops, from a psychological effect, think of that. If you have mobility issues or you can't see or hearing, you're stuck in an elevator. So it allows us to pull all that into one department and address the whole issue for all of our population.
Yeah, absolutely. On the proactive side. And that's, again, I can't, wow, that's just something that you don't tend to think about the areas where you have privilege, to be quite honest. And as a sighted person, I don't read Braille. So it often doesn't even occur to me that the information that is in Braille might not be up to date for whatever that means. And that's just a really interesting kind of way of looking at things. When you look at things through a safety lens, you're going to get safer outcomes. At least I believe you will.
Yeah, absolutely.
Yeah. And it's certainly obviously going to be better for, certainly for the public. Tell me a little bit more about particularly getting people back, because I've had conversations with folks that the working from home was actually safer for them mentally and emotionally than it was working in the office. And it's been that way actually for years, which again, particularly some folks who are in the public sector where, you get the general public who sometimes thinks, well, y'all work for me and, I pay my taxes and the customer's right. And it's happened to me when I was in the public sector that sometimes the public doesn't really treat public sector workers all that well. And when you have to face them, it makes it even more difficult. So talk a little bit about, that bringing people back. And did you all try to do any things different or some, how did you kind of work through that situation of bringing people back into the office after being at home for such a long period of time?
Now, one of the great things was we didn't have that many people working from home because of all the essential services, especially that a county has to provide, which is, different from a city or a village or a small municipality. But when we did start bringing people back, one of the great things they did was we had a kind of emergency leave policy. So if people were exposed to COVID, had COVID, we didn't charge them their vacation time, their sick time. And so that was a relief because you had people that were new employees that didn't have, 3-4 weeks built up. You had people that had surgeries and exhausted all their sick time before COVID. And so the stress of saying, if I catch this virus, how am I going to go without a paycheck for 2 weeks? And so we were able to kind of calm that and say, you know what, we've got you. We're going to take care of you. And we had, there's a whole process for that, of course, to make sure checks and balances and stuff's not abused. But that worked well because it eliminated that factor. And people were more apt to tell us, hey, I got exposed or I was, I'm not feeling well, because that's an issue everywhere, right? we've all done it. I got the sniffles. I wake up. I'll be fine in a couple hours. I come into work and I just expose my entire office. So it really kind of eliminated that. It was like, nope, go home. We got you for today. Let's see how you're feeling in a couple of days. So it bridged the gap pretty easily.
Yeah, there, as much as, as the COVID-19 experience for the entire world had a lot of negative parts to it. Obviously a lot of folks lost their lives. A lot of businesses failed. A lot of governments really struggled. It created all kinds of challenges. But just like everything, if it's negative, there's got to be a positive side to it. And the positive side is what we learned and what was exposed. I at least my view is that the pandemic really didn't change anything, but it exposed virtually everything, because things that were already weak were the things. So people who already had pre-existing conditions and illnesses, they're the ones who were more susceptible to the virus. Businesses have failed. Many of them were really struggling to begin with, and they didn't have what it took to be able to survive. And so the lessons that we've learned, or hopefully we've learned, hopefully should make us better, as we kind of adjust to a different kind of world. And can you think of, in addition to can you think of some things in general from a safety perspective that you actually see, the community that you serve and the employees that you serve, it's better now than it was prior to the pandemic?
Yeah, I think, especially from the public service side of things, it's really kind of done three things for us. It's improved a focus on mental health accessibility. So when you start, talking about the reasons people can't get there, so the number of mental health providers in the community as a whole, the distance it is from somebody's house. We just had a conversation last week, and one of my peers was saying, I live on an island, so I have to drive for everything. It's not uncommon to drive 10 miles to go to the grocery store. But if you're sick, or if you've got, some kind of mental health struggle that you're dealing with, driving 10 miles to a provider is unattainable. Some days you're just struggling to get out of bed. And so really it's kind of started a conversation around that. One of our local nonprofits does an excellent job with kind of mental health first aid training. So they'll come in, and they're a partner with the county. So they'll come into our departments and do training on, it's different levels of it, but it's Prevent Suicide Now. So you have, here's what to look for in your coworkers when they're struggling. These are the things you need to bring up and say something about, so we can get these people referred to, our EAP program, get them free mental health counseling, make sure they're aware of the services that's available to them, whether it be through nonprofits or the county's, medical plan, or other, kind of resources that's out there. Some simple things like they do our community started a trauma sensitive yoga. And so it gets people together that all, have had these kind of similar traumas that have happened to them. And they spend an hour doing yoga and kind of working through it. And so bringing these little different aspects of the community together has been good. I hate to say it's been fantastic because it came from such a negative thing, but yeah, sure. It's really ignited the conversation around that in the community and in the workplace.
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all Flourish DX Academy courses included within the Flourish DX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with Flourish DX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
And that's something that, again, a local government has that often private sector organizations don't, is this broad approach to everything, because of the thousands of people who live in the county where you provide service, they're all different. And there isn't one way that's going to work for everybody. It just isn't. And no matter what you do, tell people when I chat with folks who are going into the public sector, what you have to get used to is no matter what you do, somebody probably won't like it. There's no way, because we're just different, and that's okay. But this ability to be able to look at things different. So you mentioned a number of different types of things that you're doing. And, obviously y'all haven't gotten hung up to say, well, it's got to be this or that. It's just providing this kind of potpourri of options for people, because people are in different places.
Yeah. And it's a big push, mental health from our board. So that makes it, I guess, easier, because we already have the buy-in. Our HR department has buy-in. All these different facets of our community, our nonprofits have buy-in from our board of commissioners. So it makes it really easy to have those conversations. And then if you've got buy-in from the board of commissioners, you've got buy-in from department heads. Right? Absolutely.
It's amazing how that works, right?
Yeah, absolutely. So, it makes those conversations a lot easier to have.
Right. So is there a kind of a broad, consensus across the board, or is there a particular champion, or is it, how is it working at that level?
So we do have a particular champion on one of our district representatives is huge on mental health.
Sure.
And then when it transfers down to the county, we have people that work around strategic planning, and we're dealing with all the different priority areas throughout the community. And then those partnerships with our nonprofits, and saying, we call it the blueprint. So we have the Chatham County blueprint. It says, here's what we're going to tackle. And then we've got a organization that we work with closely that convenes the community partners necessary for that. So for instance, education, quality of life. There's a whole community advocate group that kind of does the work and provides the feedback with, government representatives and just people that care. I mean, there's just people from the community. It's not their job. They just show up. And then we can kind of take those back and go back to the board. Here's what's going on. Here's areas that need funding, and really kind of a whole community approach. It's, you'll hear a lot around here, one Chatham. And so it's what we kind of want is, it's not the city of Savannah or, the town of Thunderbolt. It's Chatham County. We're all in this together. Our residents cross lines, and, they shop in different areas and they work in different communities. So we've really got to be one to address our challenges.
Absolutely. Yeah. So share a little bit about your team. So can I assume that most of your team have you all been together for a while, or have you? It sounds like you've grown a bit, but do you have a core of folks? How did it work for you all to come through this? Because while you're helping other people, there's certainly things that you all have probably needed yourselves.
Yeah. So when we started 7 years ago, it was basically early 2016 by the time we really got started. There was three of us. We had a risk manager that worked in finance. We had a kind of a safety trainer that did mostly driver training. And then we had the ADA coordinator. And then they hired this guy from Tennessee to come down to Savannah and try to fit in. And so we kind of grew that. And now we've got a safety training manager that does all things safety training. We're working from HAZCOM to confined space, of course, driver training, first aid, CPR, which is really important to us, to the ADA aspect, the facility safety coordinator, ADA. We kind of merged a couple positions last year to make that happen. So that's new. We have a safety manager that just focuses on people. Mm-hmm. So when you look at, kind of those personal relationships, those toolbox talks, safety meetings, hey, I've got an unsafe work condition. That's their bandwidth. That's all they tackle. And then of course, risk management, we're self-insured. So we do all that in-house. And luckily we've got glue that holds us together. We've got a fantastic admin assistant.
Right.
like every good director, I have to mention, right?
That's right. Yeah. No, I understand. I married an administrative assistant 30 plus years ago, so I know what it's like. So if you were to just look at the public sector in general, what would you say are some of the things that the public sector could do to create a safer? Let's start with a safer physical environment for workers.
And so you kind of mentioned it with the state plans with OSHA, right? So when you have a population that's not covered by OSHA, it's really hard to convince them why they need to follow those minimum guidelines, right? It's not great. OSHA's minimum guidelines. And so you really have to focus more on buy-in than you do kind of being that safety police or that, beating them with the stick. You can't do that. So you've got to convince supervisors that are getting that pressure from their boss, from the constituent, from the board to make sure this service is performed on this day, to really saying, hey, we need to take the time to do it safely so we have people that can perform that service tomorrow. And so I think from this goes back to, it's all about personal relationships when you're dealing with things that aren't regulated. And then it's kind of a double-edged sword. You hear people say in public sector, well, I wish we were regulated by OSHA. Well, that has its own set of costs and things that come with it. And also there's some things that aren't practical when you're dealing with like correctional facility. You just can't meet because you've got to worry about safety of officers and safety of inmates differently than what the standard may allow.
Right. Absolutely. Yeah. Well, it's an important point that you brought up about the value of relationships, because I'm certain having to start one of these from scratch. Well, that probably took a lot of, a lot of relationship building. And as you said, I mean, it's a double-edged sword. I heard once that people do safety related things for one of three reasons. Either they have this ethical center, they believe it's the right thing to do, and they're just going to do it anyway. There are others who look at the bottom line and have figured out that it's going to save them money. It's going to be much more efficient financially. And then there's the last group who, does it because they have to. And, the way I look at it is, it doesn't matter why they're doing it. It matters that they do it. And often that's held together by relationships. Mm-hmm. It is.
Yeah. And we focus a lot too on, we talk about those relationships, right? So I kind of have this theory, safety glasses are cheap. I need my employees wearing them at home as well.
Right.
So I don't care if they take, a $2 pair of safety glasses home with them while they're weed eating or while they're, cutting wood. Because if we protect their eyesight and prevent that eye injury, they're coming back to work Monday safely. And we've protected that family. So it really, I guess from a psychological standpoint, you got to get that deep relationship to let them know, no, I don't care about you from 8 to 5. I care about you 24 hours a day. I care about what goes on at your home. I care about, your kid wearing a bicycle helmet, all those things, to help build, like I said, to build those relationships, to cultivate that trust, which is kind of what we're talking about today, is if your workers trust you, they're going to communicate with you when things aren't right, when they're not feeling safe, if they feel retaliated against, like whether it's a physical or psychological hazard, they tend to bring that up because, you looked after their family as well.
Right. And you've delved into it just a bit with those last few comments, but share a little bit more about, so why is mental health important in the public sector workplace?
I think mental health is probably, not to rank it, it's probably one of the top 3 most important things we face in our workforce. Because you have kind of greater job stability, lower pay. So you have people that, there's people that may work for you in public health that are on supplemental programs. They're getting food stamps. So they're having to deal with that, factor of they're struggling themselves, but they're still service-oriented people, so they've chosen to do that. The other aspect of that is mental health. It's something we all face. We all have struggles. We all deal with that. So kind of improving access, improving the conversation, the willingness for people to share freely. It just, again, it goes back to building those relationships.
Right, right. Yeah, and just so again, it sounds like part of the success that you've had has been based on a really, supportive group of elected officials. So let's say you had an audience with a group of elected officials from someplace else who are still trying to, they're still trying to figure this out. They, their workers' comp costs are high, or they seem to be, wrecking stuff and hurting people a lot. What could you share with them? Maybe one of them's listening right now. What would you share with them about the value of the process that you all have there and why they should do something similar?
I think the value speaks for itself when you talk about protecting people and saving lives and injuries and returning people home. But to get started, you just got to get started. So much time is spent in government. We're all guilty of this. It just takes so long to do something. I think when it comes to safety, just doing something is better than doing nothing. So you've got to get, maybe you don't have those resources to hire, a dedicated safety person, but you do have that couple $1,000s that you can set aside because somebody in that organization is going to be passionate about safety. There's a safety champion somewhere. It may be at Public Works, it may be at the police department, maybe at the fire department, but get them and cultivate that and train them and bring them up so that way they can kind of implement these programs and you can start seeing the value. And as you're seeing value, you can then put more resources into that and start growing that program.
Yeah, I can make the argument that most effective safety programs, particularly in the public sector and generally in any sector, they're actually cost neutral because you're spending the money anyway. I share the experience of going to the city of Atlanta a little over a decade ago, and they'd done an audit, and the audit suggested that they had spent $12 million in the 4 fiscal years each year in new workers' comp claims. Mm. And it seemed like a lot of money and nobody really knew what was going on. And the ability to be able to go in there, so they create a position and, bring some guy in who had been teaching college and decided he wanted to settle down. And we were able in a year to save the city about $4 million. And the part of the savings was, well, why don't we have a safety orientation for workers when we hire them? That's it's simply putting people in class for a day and letting them know that the safe way to do this thing. So this is what a bloodborne pathogen is. And this is where the first aid kit is. Here's how you get out of the building. Basic stuff. I mean, really basic stuff. And I share with you, I was there for a couple of years. I never had a staff and never even had a permanent office. But most of it really just paid for itself as just less money that was going out the door, injuring people.
Yeah, when we started here, I said 7 years ago, that first year was kind of a culture shock for me. We had 34 lost time accidents. I was like, well, what is going on? That's a lot of money. That's your medical cost, your surgeries. And, we've gotten that down to about 4 now, which is just fantastic. But it's the little things you talked about. It's orientation. It's showing up at 7:00 in the morning when they're starting work. It's showing up when it's 105 degrees outside and delivering popsicles. I mean, it's one of those small things we do.
Right.
But they talk to you on the side of the road and they appreciate that.
Right.
And then you get to have those conversations about, hey, your gloves are ratty or your vest is not meeting the standard. Like, vests are dirty and they're not reflective anymore. Let's go to the car and get you a new one.
Right.
So kind of bringing in all of those things, it's very small changes. People look at, I need to build this huge safety program out and I need to be like, Atlanta, or I need to be like this city or that city. No, you need to be like you.
Yes.
Right? What makes sense for you and your organization, right? And just get started doing something.
So I want to make sure I didn't miss that. So are you telling me in 7 years you've had close to a 90% decrease in lost time injuries?
Right now. So we still got a couple months to go this fiscal year, but
wow.
But yeah, it's something we're pretty proud of. And a lot of that is, you talk about simple changes. One of the things we did was institute a nurse line. So when I have an employee that's injured 24 hours a day, they can pick up the phone, they call a number, it's dedicated to our employees, and they're speaking to a nurse case manager instantly. And so appropriate level of care, right? Everybody gets hurt, they run to the emergency room. The doctor writes it, they're off work for a week, take this, do that. And we're able to have that personal relationship with their contractors for us, but it's the same people. Right. So they can call them back and say, hey, I've got a question about this prescription or this physical therapy. And it's an advocate for them. Mm. And then we're getting that first touch, that first point to say, you know what, like, you fell, you hurt yourself, but you don't need to go to the emergency room. You need to go to, this urgent care. And you're not directing them, of course. I want to be clear on that, right? Mm-hmm. But you're providing all these other options to them, especially during COVID, when you would not want me to go to an emergency room. I did not want to go there. Did not want to be anywhere near a hospital.
Right.
And so providing that care, again, looking after their safety, because that causes anxiety. When people get hurt and you send them straight to the emergency room and everybody around them sick with something that's contagious and, all over the news. So you got to quell that anxiety and say, here's the plan. We've got these options for you to choose from.
Absolutely. Wow. Okay. I'm gonna be thinking about that for a while, because that's wow. That just needs to be shared. 90%. And how many people can say that? And again, as you shared with us, it wasn't complicated stuff. It wasn't super complicated. I'm sure some of it was hard, but it wasn't complicated stuff. That is absolutely outstanding. So if you, in your crystal ball, if money wasn't an object and everybody said yes, but what are some of the things you see, for your group and then for the public sector? Let's just talk about your group, because, you've got a little bit of influence there. What's up next for you all? Where are you going next?
We've got so much stuff we're trying to do. The big thing for us, we're trying to deep dive into data. So that's kind of our big focus this year. We've put some new systems in place and databases so we can get more granular in what's going on. Those broad brush fixes have worked well for us. But if you really want to start now making those small changes, we need to dig in and see, why are people falling? So, for instance, we had an issue at the correctional facility where officers were coming off, the officers are up high, looking down on, inmates so they can kind of keep a bird's eye view on things. And then when something would happen, they'd fall down the steps. And it's as simple as, well, the floor is gray, the steps are gray. They're in a hurry. Their visual perception is off. So you do things like paint the steps yellow, and alternate, and those injuries are gone. But you can't see that without data analysis.
Right. So
having get more granular with that is just going to be huge for us moving forward.
Wow. Yeah, that's I had I tell the story. I had a person call me. It's actually when I was still chairing the government public sector division. They called me from a zoo, and they were asking about the health effects of exposure to flamingo urine. I'll never forget that story. and what it ultimately came down to was it's really high in alcohol content. So it's what happens when a person gets exposed to alcohol. I mean, it's really but in a that's why it's so important to have folks who are in the public sector who can kind of work with each other, because you don't get those kind of questions. Not everybody has a correctional facility with steps that they have to worry about folks falling down. But the fixes, so if you all can do it, as a matter of fact, I'm sure you'll find with this data that you're not the only correctional facility who has, these stark colors and, correctional officers getting injured and so on and so forth. So, wow. Well, I tell you, we could, there's just so much that you all are doing and so much progress here. It's really exciting. It's really great to hear. It's great to hear. Good to hear that, and again, to see, in your case, to see something start from the seedling to grow up to be what it's kind of like having kids grow up, and having things really, really get great. That's great to hear. So anything we haven't chatted about you want to share with the folks who are watching and listening?
No, I think it's, just going to mention again, just look out for each other. Look out for your neighbor, look out for, the person picking up your trash. Take time, appreciate them, let them know that they're welcome. You appreciate the job they do every day, because they're there when it's snowing, when it's raining, when it's hot out. They're outside in all the weather we don't want to be out in.
Right. Absolutely. Well, Nathan Benson, thank you so much for joining us in this episode. For those of you who are listening or watching, please do stick with us. You can follow the podcast on LinkedIn. We have lots of information and connections going on there. We're up to well over 1,400 subscribers. And if you haven't subscribed yet, please do. You can follow us on the Flourish DX YouTube page. Again, you can like and subscribe there for those of you who want to watch on YouTube. Our goal is to continue to connect the community of people who care about the psychological health and safety of all people in all organizations, in all industries, to include folks who are serving us in the public. And so again, Nathan, thanks so much for sharing your story and what's going on with you all. And I'm sure we're going to be hearing more of the great things you all are doing. And again, thanks for the time that you've spent. And for those of you who are waiting with bated breath, this episode is coming out during National Safety Month. That's why we have great safety professionals like Nathan Benson. And we're glad to have him and glad to have him share. So go out and, take some of the information that you've heard today and share it particularly with a public sector person, somebody who's doing some good for you in your community. I'm sure they'd love to hear it. So until next time, thanks for joining us here on the Psych Health and Safety USA podcast. Thanks very much. You've been listening to the Psych Health and Safety USA podcast. To stay up to date with the best content on workplace mental health in America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.